Hi, my name is Dr. A.B. Mendelsohn, and we're here today to talk about gender-affirming vocal surgery, or vocal feminization. Gender-affirming vocal surgery is actually a group of different surgical procedures, all geared towards making the voice more gender-affirming, and doing so through the mouth, no scars, and most importantly, still allows the patients to have all the amazing aspects of their voices, including singing, screaming, intonation, all the things that we expect out of our voice we can still do after gender-affirming voice surgery. There are at least 50% of our trans population that are unable to achieve their vocal goals through voice therapy alone, and that's where surgery comes in. So really, when we're thinking about who's a good candidate for vocal feminization, is someone who cannot reach their vocal goals through voice therapy alone. It's also important to work within a multi-specialty team. In other words, you want to make sure you're in a center that can offer not only the surgery and the aftercare, which are both critical, but also getting you back into those voice therapists who have experience specifically in gender-affirming voice therapy. Vocal feminization surgery requires general anesthesia and is typically performed within about an hour. So when we try to achieve a gender-affirming voice change or vocal feminization of the vocal cords, we're treating the vocal cords really like guitar strings. And so when we think about how a guitar string vibrates, or the pitch that the string creates, is due to the thickness of the string, the amount of tension that's on the string, and the length of that string. And so we don't want to mess too much with the tension, because when you mess with the tension of the vocal cords, the ability to sing sometimes can be really poorly affected. So what we're doing with our glottoplasty is what we're trying to do is shorten the effective length of the vocal cord. The best analogy is just putting a capo on the end of a guitar string. So it just increases the pitch of all of the strings there and still allows you to play that beautiful music. Specifically for gender-affirming voice surgery, the risk is that we're operating on the vocal cords, and so there's always a risk to damaging the voice itself. Aside from not achieving your gender-affirming goals, but there are risks to the vocal cords. How do we minimize this? We need to make sure it's done by someone who knows what they're doing, has done this a lot. So recovery from gender-affirming voice surgery from a discomfort standpoint is relatively quick, several days, maybe a week at most. But more impactful, not necessarily is the discomfort, but is the requirement for vocal rest, meaning no talking whatsoever. I tend to be a little bit more conservative and only recommend 2 weeks of strict voice rest. Some surgeons will recommend as much as 1 month of strict voice rest, meaning no talking at all. The reason why we're only doing 2 weeks is because during the surgery that we perform here, we're also putting in some Botox into the vocal cords, and that Botox will allow those vocal cords to be a little bit weaker on purpose, meaning not being able to push too hard or ruin some of our good work. That Botox is temporary. It will wear off over 3 months during that healing phase and really give us that 3-month time where it's just perfect voicing. For the first 2 weeks, the voice doesn't sound like anything because there's strict voice rest. Between 2 weeks and 3 months, the voice is very uneven, unpredictable, and sometimes even gruff sounding. That's due to the swelling and some of the Botox that's left on. Between 3 months and 6 months, we're seeing approximately 70 to 100 hertz increase in the comfortable speaking tone, meaning the pitch. And then at 6 months, we can really expect that final result. So we're seeing tremendous improvements in terms of the number of insurance plans which are covering things like voice therapy and the office visits and examinations. Unfortunately, the glottoplasty is still what's called an unlisted code, so sometimes there is a shared cost that's required out of our patients, but ultimately here at La Center, we're really going to work with every patient to see what can be done.